So this is should be a pretty good panel of folks. We're going to talk about CBD dosing. We'll probably talk about a whole lot of other things, you know, through the dosing conversation. But just real quick, are you guys here for the most part? Are you here because you're interested in selling CBDs, you're patients, you just have kind of an interest in cannabinoids? I mean, how many people are interested in CBD businesses? Okay, and then how many people are just kind of interested as patients and interested? Okay, good to know. Just good to know the audience, right? So always
any healthcare professionals, physicians, pharmacists, nurse practitioners, PAs.
No. Oh, go ahead, sir. So are you kind of in that category? Okay. So, and that's a very good question too. Thank you. By the way, my name is Chip Paul. We have a CBD brand here called True Medix, and then I also research the endocannabinoid system in our company called New Pharma. So, but I would like to, really this panel is great. And kind of, all that. So let's start with you, Richard.
Hi, my name's Richard Harris. I'm an internal medicine physician and pharmacist, and I always like to start off speaking by thanking my Lord and Savior Jesus Christ by allowing me to come speak with you guys today. It's a true pleasure and an honor. It's great to actually do something during this time period, right, to be amongst people. So my background is all over the place. I went to pharmacy school first, worked as a pharmacist at MD Anderson, realized I wanted to go to medical school, went to medical school here in Houston, worked at a large practice for a while, hated it and realized I wanted to go holistic, looked at all the options, didn't want to pay all that money, so I spent a year reading every single clinical trial I could possibly get my hands on. So I read 700 clinical trials in a year, and then taught myself holistic medicine because I've never been experienced to it in pharmacy school or medical school. And then realized I wanted to become a physician entrepreneur, went and got my MBA, and now I started a whole bunch of companies and I'm running around like a crazy man. But my primary passion is two things. One, to help create informed health consumers so people can make decisions about their health from a place of power. And two, to create scalable efficiency in medicine to help leverage technology to improve the lives of every single person.
Very cool. Did similar, went back, had to, the endocannabinoid system, and you guys might kind of talk more about this because you're professionally trained, but the endocannabinoid system, the system of why this all works, right, is not taught in any medical school. So again, all of us up here are self-taught. We didn't get it in any kind of education or school. So thank you for kind of mentioning that. Dr. Risotto?
I kind of share some of his background. My tagline is I'm a physician, advocate, public speaker, author, and entrepreneur. My medical career began at the age of 16 as a certified nurse's aide, then an EMT, then an EMT paramedic, then a cath lab technician, then a chiropractor, then a medical doctor, and then I realized I was an excellent healer, but I didn't know crap about medicine, so I got an MBA in healthcare management. And so that's been my trajectory from the age of 16 to 58. I've been advocating for cannabis use in the state of Florida prior to us having product. So in 2014, I was advocating for medical cannabis, and in 2016 was when we actually had product. I was the first in the greater Central Florida area to recommend medical cannabis to a 35-year-old female that had a stage 3 brain tumor. And 3 months later, I was the first in the state of Florida to recommend medical cannabis to a child, a 15-year-old that had a stage 4 head and neck tumor.
Awesome. That is awesome. Jorge, would you like to?
I'm just a pharmacist.
There's no such thing as just a pharmacist, Doc.
Yeah. I'm sandwiched between two of you.
I've been a pharmacist for 34 years. And I kind of fell into this about 3 years ago. I've been a hospital pharmacist for the first 20 years, and for the last 15 years, I was a community pharmacist because I just enjoyed being with people more. But who speaks to the pharmacists anymore? It's rare. It just doesn't happen as much. And my last job was at Costco. Enjoyed it. Great company. However, so many people my age and older were coming and asking me about CBD. And at that time, 3 years ago, it was illegal, and I truly didn't know what to tell them. So I started educating myself, and as they alluded to here, they do not teach about the endocannabinoid system. I was like, where has this been? I had no idea. And just like gentlemen up here, I started reading studies, and I started reading information from Israel, from Europe, from all these different places, and I was shocked at the amount of information I was reading, clinical information, some of it anecdotal, but a lot of it was clinical, both animal and human-based models, and I was like, this stuff actually does help. So I sat there and I told my wife, I said, I got a crazy hair for you. I hope you don't mind. She goes, okay. She knows me by now. I'm an entrepreneur as well. I said, I want to retire from pharmacy, but I want to specialize in CBD. And I have so many people coming to me. I said, they're on so many different medications. There are some drug-drug interactions they have to be aware of. And there's so many people selling CBD, and there's so many people making CBD, but there's nobody in the middle discussing CBD with their patients knowledgeably and being able to work with them and do the aftercare, do the dosage adjustments, make sure that they're hitting their therapeutic endpoints, or they're alleviating their pain, their anxiety, their issues that they're coming to you for. And that's what I do. And I opened my practice 18 months ago. It continues to grow. And I advocate CBD 100% of the time. And I work with patients not only with their current medications, but with CBD and how to integrate it safely into the current medication regimens.
All right. Thank you, Jorge. These guys are being humble when they say I'm just a pharmacist. For the most part, the advances here scientifically are coming, from pharmacists, really. Pharmacy school is really where you'd go to learn, about the endocannabinoid system, because in the future, it's University of Maryland right now, and hopefully Ford International or wherever soon. But there's not many people that teach it, but they will soon, and we have interactions with University of Mississippi, and I know what they're doing and how they're kind of thinking about it and talking about it. So this will all be coming, but for the most part, it'll be in pharmacy schools where the advanced pharmacology is taught, and that's what really needs to be taught, because then we'll fly as a science. So on, just real quick, so let me, go ahead.
I noticed that my daughter just graduated a few years ago.
Yep.
Within the last 5 years, they now start to discuss
Yep.
these issues.
Yep.
So it's
Yep.
becoming at least a discussion.
Yeah. So let's talk, before we talk about dosing, because the whole panel is about dosing, let's talk a little bit about kind of quality of manufacture. So again, as pharmacists and as a physician, you guys know the dosing doesn't matter if you don't know the kind of the quality, the underlying quality of what you are dosing. So Jorge, you want to take that one first?
Quality is important, and frankly, it's all over the place with CBD. I mean, I don't know. Some people are making it in the bathtubs. I don't know. I don't know what they're doing, and some of them you have to look at it, and you need to do your research. And one of the things that the reason people come to me all over South Texas is because I do the research. I follow the companies. I review what they're doing. I look at the studies. I look at the assays, and I double check everything to make sure. Because if I'm trying to dose somebody, and we're trying to get to where it needs to be, if I'm not sure what's in the bottle, when I reach in the pharmacy and I reach for a bottle of pills, I'm not concerned that what's in that bottle is what's supposed to be in there, because that's what the FDA, DEA, and all those people are there for. Unfortunately, you don't have that oversight in the CBD industry yet. It's coming, but it's not here yet. And there's some efforts to self-regulate within the industry, which I think is a good step in the right direction. But you have to really do your research and follow those companies and find out which one of those companies do quality products. And then that way, when you actually do changes to your patients' regimens or whatnot, or increasing a dose or decreasing a dose, it's not a moving target, and you're actually getting somewhere. Because, like I said, I am a CBD advocate. I do take CBD as well, and I found it to be very beneficial. And there are different instances. There's a difference between a full spectrum and a broad spectrum, and isolate, and you have to discuss those with your patients. But most importantly, the companies they're utilizing, are they reputable? Are they, they have the information? They have good manufacturing practices. There's a hemp authority certification now. It's coming out. It seems a first step in the right direction for people to see what these products can do. I'm not sure if that's the be-all, end-all, but it's a step in the right direction. So
yeah. So Dr. Risotto, real quick, on quality, we kind of know, as Jorge just alluded to, in the medical marijuana world, that's regulated, right? So in Oklahoma, we have a regulated environment. Florida, we have a regulated environment. Hopefully soon, Texas, you guys will have a regulated environment. But that's regulated, right? So there's oversight and quality kind of control and processes. In CBD, that's not the case, right? So how can you kind of talk a little bit about that, coming from kind of a regulated world and how it's unsafe a little bit, in the CBD world?
Sure. Well, the misnomer is that it is regulated in that it's tested in the state of Florida. However, there is no law mandating third-party testing in the state of Florida. It's at the discretion of the dispensaries. So many do have third-party testing, but it is not mandatory per the state of Florida. So that kind of leaves a gray area. Of course, many of the dispensaries do, because we as providers demand that a certificate of analysis be provided. And for those that don't know what a certificate of analysis is an independent lab report that shows what's in the material, what's in the product, what's in the bottle. So what percentage is CBD, what percentage is CBN, what percentage is CBG, how much CBDA, how much THCA, as well as pesticides, heavy metals, toxins, anything that's supposed to be, not supposed to be there, should not be there, and those things that are supposed to be there are there. So that's the main thing. And in the state of Florida, being a medically legal state, it's not mandatory that the dispensaries do it, they just choose to. And those that do are the ones that, as a physician, we tend to send our patients to and recommend, okay, you want to go to this dispensary. And also, it depends on the experience of the individual. If someone is naive, then I'm going to send them to a specific dispensary that works more in the ratio based. So they have a 12.5 to 1 CBD THC product, or they have a 5 to 1, a 1 to 1, a 1 to 4, and a 1 to 9. And then they have cool names like Soothe, Calm, Serene, Zen, Relief, that makes it easier for the patient to kind of gravitate towards that is naive, rather than going to another dispensary that's focused more on the experienced user, and they walk in and then they see on the wall, Granddaddy Purple, 9-pound hammer, sour diesel, that's the experienced user that has been utilizing cannabis for a while, is familiar with the terminology, and will walk in and say, okay, I want this because I've used it either in the black market or I've heard that it works for me, for my specific symptom. And so those are the ranges that we work with in the state of Florida.
And Dr. Harris, you might talk a little bit about, if I came to you and I said, gosh, I'm pretty normal, but I have a little trouble sleeping or something, about how many milligrams of CBD, as long as it's quality and as long as it's well produced, would you recommend for me, like in 20 milligrams is kind of the accepted thing, but can you talk a little bit and maybe how you might nuance around that if they had deeper problems and things?
Absolutely.
Yep.
So taking CBD for me was actually for sleep. That was the first indication for why I started taking it. I've had insomnia ever since I was 12 years old. And it got so bad in pharmacy school, I went from a straight A student to almost failing out of pharmacy school. I was only sleeping 2 hours a night. And I tried Ambien, tried all that stuff, garbage, hated it, did the research, found out it only gave me minutes more of sleep. I was like, screw this, I'm not taking this anymore. And then CBD for sleep and recovery, at the time I was trying to do a 600-pound deadlift. So I was working out really, really heavily. And so I used it for a recovery agent as well. So to answer your question, if someone comes to me for sleep, I always go first, listen, a supplement is a supplement. It is there to aid, but it is not the primary mechanism that's going to help you. If you have poor sleep hygiene, yes, CBD is going to help, but it's not going to take you all the way there. And so I'll focus on both things. I'll focus on the sleep hygiene first, and I'll say, okay, I have a product here that can help you. And then people always ask, okay, what's the dose? And I say, well, it's nuanced because there's not a whole lot of dosing studies for a lot of the indications that we use. Most of the data is in cancer and really resistant seizure therapy. So like we mentioned, 20 milligrams to 40 milligrams is about the ballpark daily dose that most people will be on for most of the run-of-the-mill, anxiety, pain, not like cancer pain, but, musculoskeletal type stuff. But I don't start them there. I usually start them at maybe 5 milligrams. If they're young, they're healthy, you can probably start them at a little bit higher, but if they're on medication, say they're on antidepressants, say they're on muscle relaxers, say they're on antipsychotic medications, there's a lot of interactions that could happen either with the medications or with the fact that you're throwing on another medication that could be sedative. So then I might start them off at maybe 1, maybe 2 milligrams, and then slowly titrate up by a milligram or 2 every single week to get to that goal of, they ask me, okay, what's the final dose? I say the final dose depends on how you feel and are we having side effects. That's where the final dose lies. And so for me, I take somewhere between 20 to 40 milligrams a night, depending on what I have to do the next day. If my next day is like today, where I am literally running until 8 p.m., then I'm gonna take 40 milligrams. So I make sure that I am well rested. If I don't have much going on the next day, I'll take 20. But you wanna always start at the lowest dose that gets you a response and then titrate up slowly, because it does interact with medications, it does interact with our physiology. And so you don't want someone to have a bad experience, say they take 40 milligrams and they're zonked out the next day. And they're like, well, this sucks. I slept, but now I'm tired all day. I don't want to take this. So we start low and go slow.
Good idea. Jorge, do you want to, same type question, let's say you get a patient, where do you start, kind of in your mind with dosing, and then how do you kind of move back and forth depending on what the severity of that condition is?
Just like Doc says, it's very nuanced based on the individual. Just before I get into that, I want to say one last thing about the COAs. A lot of companies do COAs as standard now, but you have to look at the COAs, and you look at the lot numbers, and you look at it and like, the COA is 2 years old. Mm-hmm. This doesn't work anymore. I need a recent one. Oh, then the recent one, I can't produce one. And I said, well then that's, you tell me what I need to know at that point. So just because there's a COA is there doesn't mean it's necessarily a good product. So you have to be aware. There's ways of checking and evaluating products, even with COAs. Going back to the original question, yes, say I have a 30-year-old, okay, relatively good health, then they require a certain, usually between 20, 40 milligrams is what it works, and up to 60 milligrams depending on the individual. I start low and slow as well. And then what I tell them is about 72 hours, 3 days, 4 days. I like to talk to them once or twice a week, and we see where you're at, how you're doing. I'm feeling much better, but I'm not there yet. And I always do a scale. Give me a scale of 1 to 10. How has the improvement been? So they can I can rationalize in my mind what dosage adjustment we need to make. But if I have a 90-year-old coming in, and they're on a bunch of different medications, and they want something for sleep, which insomnia is very common in the elderly, I'm not going to start them in 20 milligrams or 40 milligrams. I'm definitely going to start at the lower, especially if they're naive. They've never smoked anything. They've never done anything. I'm not going to start them at a higher dose. I start at 5 milligrams. And the drug-drug interactions are real. 60% of all the medications we take are metabolized through the liver. The liver is where CBD is also metabolized. So think of it as a funnel. It backs up when too much stuff is trying to come through there. And that's when you get into trouble with these drug-drug interactions. So you have to look at the overall medication regimen that they're on, and then what it is you're treating, and then kind of work your way through. And it's experience at this point, because the data is still maturing as to people are now studying it. They're putting, much more emphasis on dosing and things of that nature. It's just not there yet. So we're kind of anecdotally working here, but with some experience as we have up here at this podium. So it all depends on the individual, their age, the severity of their symptoms, and their current medication regimen. And low and slow is the best way to go always. The minimum effective dose is what we're looking for. I'm not looking to sell 1,000 milligrams of CBD. I'm looking to sell how much CBD you need. And if you only need 5 milligrams a day, then you only need probably 300 milligram bottle to get by for a period of time. So it varies on individuals. I wish it would be more specific, but it's kind of hard because it's not there yet.
Yeah. No, that's a good answer. And we're CBD manufacturers in kind of one company. And when you manufacture CBDs, one of the things that you have to do, to your point on COAs, we'll get a COA on our distillate that we use, and so we do, COAs on our underlying distillate, and then we do purity, on what we're sending out. So it's, but you, in the CBD world, you guys have no net as patients or retailers. There's no net right now. The FDA soon is going to issue some guidance, but there's no net right now. That guidance is interesting. It's going to look a lot like OTC, like capsaicin or whatever, but this is what we're being told. Dr. Risotto, do you want to talk also about dosing? But you probably know a little bit more than the rest of us about terpenes and potentially how terpenes might modify a CBD effect. So can you kind of address that a little bit?
Sure. One of the other challenges regarding the dosing is, if you look at the literature, there are studies or reports written where the range has been 0.1 milligram per kilogram per day, as high as 20 milligrams per kilogram per day. So if you take someone that weighs 150 pounds, that's 70 kilos, that individual, the range is anywhere between 7 milligrams per day to 1,400 milligrams per day. So you see what other medication exists that has that broad of a range from 7 milligrams to 1,400 milligrams. So not only that, but cannabis in general, but CBD also has what's called a biphasic effect. What biphasic means is that at a low dose, it has one effect. At a higher dose, it has a 180-degree opposite effect. Case in point, erectile dysfunction. If you give a low dose of cannabis to a male that has erectile dysfunction, it will stimulate their libido and will stimulate an erection. On the opposite end of the spectrum, if they use a higher dose, it has the exact opposite effect, and it reduces their libido and does affect the erectile dysfunction. So you have to be able to manage and find that specific sweet spot. Now, in conjunction with the phytocannabinoids, and tomorrow I'll be participating in a panel discussion where we will be talking about not only CBD, but the others, CBG, CBN, CBC, THCA, CBDV, etc., at the same time, 10:15. So we'll be addressing more of the other phytocannabinoids. But in conjunction with that, you also have what are called the terpenes. Terpenes are what give the plant the sense of smell and taste, okay? It's what gives pine the smell of pine. Pinene is a terpene. Limonene, which is found in citrus, is another terpene. Beta-caryophyllene is found in black pepper. That's another terpene. Each one of these, linalool, which is found in lavender. Now, within each one of the terpenes, you now have these that stimulate certain effects. So the doctor, pharmacist here that has insomnia would use a product that would be rich in linalool, has lavender base in it. Why? Because it'll help relax him. It'll help bring him down. And it's been used for years as aromatherapy anyway. So adding the linalool to the CBD is going to support what he's got going on. Another individual, they may have pain, then you're going to want to add like a beta-caryophyllene that's going to support the pain component, so musculoskeletal pain in conjunction with the CBD. Or you have someone that has gastroenteritis or gastric issues or gastric reflux. Then you're going to want to add limonene, which is lemon, because the lemon in conjunction with the CBD is going to help because you've got a lot of CB1, CB2 receptors in the gut. So the CBD is going to be working on those receptors, but now you've added the limonene, which is the lemon, which is going to also help with digestion. I don't know, what your cultural background is, but whenever I was sick, my Puerto Rican mother would make a lemon tea. She'd grab and she would throw in maybe some chamomile and some other herbs and create this tea. Well, all she was doing was mixing and matching different terpenes that were helping my stomach.
Yeah, no, great answer. You pharmacologists, a lot of these, linalool in particular, GABA A, right? So a lot of these guys hit other channels that are, and safely, right, which is nice. And let's talk about that. So Dr. Harris, do you want to, if that's okay, do you want to talk a little bit about your pharmacist? So you're going to talk about contraindications, you have to, but talk about kind of the relative safety here of, someone taking CBDs, with or without other drugs. So, sure. Yep.
Yeah, one of the reasons I absolutely love CBD is because of how it works. So typically we think of whenever we ingest something, it has a direct action, and CBD does, but most of its action is indirect. Most of its action is actually boosting our own natural endocannabinoids. All right, so it prevents them from getting digested. It actually frees them up from the binding molecule that carries them, so there's more active to bind to those CB1 and CB2 receptors. And that's the reason I love CBD, because it's potentiating what our body naturally does. So how many therapies out there that actually do that? All right, there's not a whole lot that you can say that actually potentiates what the body naturally does. It makes us a more efficient version of ourselves. And because of that, CBD is really, really safe. Now, most of the issues that I've seen with CBD are when people are taking CBD from a smoke shop, right, where they have no idea
or 7-Eleven.
Right, right. You have no idea what's in that product. Zero idea. I mean, that could be gasoline for all you know. They could be pumping it from the pump and putting it in the CBD.
You don't buy your sushi at 7-Eleven. You don't buy your CBD at 7-Eleven.
Exactly.
That's a great point.
So that's most of the issues I've seen with people having CBD is the products are adulterated, contaminated with toxins, pesticides, heavy metals. From pure CBD, if you look at the literature, the side effects are pretty benign, and most of it is actually related to what people are using it for. So they'll say, okay, people have headaches. Well, you're looking at it's a migraine study, right? Or people have GI side effects, and so everybody has GI side effects, right? It's really hard to tease out when you do like placebo studies. What are the number 1, 2, and 3 things that people have in placebo studies? Headaches and GI symptoms. And really, the proportion you see with CBD versus placebo is not that much higher. And usually in that case, it's when people did what we say don't do. They just jump into 40, 50, 60 milligrams at once, and they're naive, and that's when people have problems. So all the people I've recommended CBD to, I've never had anyone come back and say they've had any type of adverse effect that was related to CBD. Most of it's either the quality or it's because we increased the dose to a point where we started to have a medication interaction, and that's when we either back down on the CBD or back down on the medication, depending on what it is.
Good. You guys want to on safety, you might talk about and Jorge, you've got a lot of, and I know both you guys have a lot of practical, and I don't know your prescription, actual recommendation experience, but I know you guys are both work with a lot of patients. So you might talk about safety, if you've ever seen anything bad happen, and then also kind of lowest dose, highest dose, like we talked about, because I know some of our customers, are on quite high dosages safely, or appear to be safely. So,
it's very safe. What I tell people is this: I said, what's interesting to me about CBD, and as a pharmacist, every drug, one of the things you look is your LD50, which is the lethal dose where 50% of the people die. What's interesting about CBD is that, to my knowledge, there's not been a lethal dose established yet. So you cannot overdose on CBD. You can overuse it and it have a biphasic effect, which is not what you're looking for, but you won't die from it. You can overdose on Tylenol, Motrin, aspirin, which is over the counter, and you just buy those anytime you want, but not on CBD. So it's very, very safe. It's one of the things that intrigued me about it. Secondly, we haven't discussed here, but when you talk about dosage, you also talk about dosage forms. For example, there's topicals, there's orals, and there's a variety of difference. If somebody has a swollen knee, sometimes and it just happens every once in a while, they really don't need CBD all the time. If you use a topical CBD, and when you use it topically, it usually has a local effect, which means it works primarily. Now, you have some systemic absorption. Our skin is our largest organ in our body. So you have some systemic absorption, but it's not that much. But topically, it works extremely well for issues. So there's varying strengths as well of that, and there's ointments, and there's lotions, and there's creams. So it depends on the different type of dosage form as well. Orally, you have sublingual drops, you have gel caps, you have gummies, you have different forms as well. So I don't get into the edibles and stuff, that type of stuff, because to me, it's not something that you just, it's a product that you take to feel better, not to eat like that. And that's why I don't get into the edibles that much. I do have some gummies because I do have some children I work with, and some people just like gummies, but I don't. But some people do. Sublingual oils work very rapidly, quickly, a little faster than gel caps.
Okay, and let's talk about, you might talk a little bit about methods of, ingestion, sort of how to take it in, but also safety too, if you want to touch on safety.
Sure. So the basic modes of administration are the one most common that everyone knows is inhalation. Mm-hmm. Okay, so inhalation, it's the second fastest route of administration. 3 to 10 minutes, it's in the system. Challenge with that is if you've never inhaled, like my 80-year-old mother, who's never inhaled anything in her life, giving her an inhalation product would be a waste of her time and money. So, but that's the most common, most easily accessible. It's easy to titrate. The challenge is it's rapid onset, but it also disappears relatively quickly. It only lasts 2 to 4 hours. So you have the patients inhale every 2 to 4 hours. There's different modes of inhaling. You don't always have to combust. You could use what I do, which is a dry vape, where it's a handheld vaporizer. You set the temperature, which is of benefit because by using a handheld dry vape, you vape the actual flower. And the example I give to people is, remember the Easy Bake ovens? You used to make pies and cakes. There was no flame. It was a light bulb, and you controlled that. So it's the same thing. Each phytocannabinoid has a different vaporization point. And so based on that vaporization point is where you have what's called decarboxylation, which gets a little deeper into the conversion of the acid form to the active form. And so every one has a different temperature setting. And so depending on what you're wanting to work on, you set the temperature based on what it is that the effect that you want. That's how I recommend in my office. So that's the most common one. Second is the sublingual with a tincture or a concentrated tincture where they put it under their tongue. The onset is 30 to 90 minutes and it lasts anywhere between 4 and 6 hours depending on how the person metabolizes. The challenge with that is the taste. Sometimes it tastes like dirt and people that have a very sensitive palate don't like it. But it's easy to regulate in line of the start low, go slow, because most of the droppers have a gradient on them, and so it's 0.25, 0.5, 0.75, 1 milliliter, and each milliliter, if you have 1,000 milligram bottle, then you've got 33.3 milligrams per 1 milliliter or 1 full dropper. So you divide that by 4, and now you know what 0.25 is, 0.5, 0.75. And so what I do is I have them do it for 6 days, and then I have them do what's called a cannabis holiday. And a cannabis holiday is not going to Colorado for the weekend. A cannabis holiday is you take 24 hours off for every 7 days that you're on the medication. What that does is kind of like rebooting your endocannabinoid system. It's like doing Control-Alt-Delete to your endocannabinoids. And it allows for that rebooting, and then on the 8th day, you start at a higher dose, the next level up, and continue that. So that's easier to regulate. The next is oral. The challenge with oral capsules is that if you don't know what the dose is, then it may be too much or it may not be enough. And that's where you run into problems because the patient will come in and say, this is crap, what you sold me, it doesn't work. Or the opposite extreme, I was asleep all night, but I've been hungover all day. I don't feel right, I don't want to do this, and you've lost a client, you've lost a patient. So the challenge with orals, including gummies or any edible, is that it takes up to 2 hours for it to start working, but it can last anywhere from 4 to 6 hours. 6 to 8 hours. And then the topicals can be for 12 hours, all the way up to 72 hours in the form of patches. Now, the problem with patches is people want to use them like a lidocaine or a lidoderm patch, where they put it where it hurts. You don't want to do that because it's not going to work. So like fibromyalgia patients love patches. But what's the challenge? They stick it where it hurts. They put it on their neck, they put it on their low back, they put it you want to put it where there's a source of blood, a blood supply, superficial blood supply. So on the inside aspect of their wrist, or the inside aspect of their arm, or their groin area, behind their knee, on the inside aspect of their ankles. Please do not have them put it on their neck. I had one patient put a patch on her neck and had an allergic reaction to the adhesive. And so when she took the patch off, she had this red mark on her neck, and her husband freaked out and thought that she had a hickey.
And you got in trouble.
Yeah, Dr. Rosado. Where'd you get that? Dr. Rosado gave it to me. And then there's another method that is borrowed from the Ayurvedic world. Well, there's two others. One is suppositories. That is the fastest route. But CBD or THC is not absorbed readily intrarectally. It has to be a prodrug, which is the delta-8 hemisuccinate. Delta-9 hemisuccinate. Delta-9 hemisuccinate in the body converts to 11-hydroxy, which is 4 times as powerful as delta-9 THC. So the suppository, so if you introduce CBD or THC intrarectally, you're wasting your money because it doesn't work. It has to be the prodrug. The other mode is borrowed from the Ayurvedic world, which is the Pikoti or Pichoti method. Anyone know what that is? Any Ayurvedic or yoga practitioners in the audience? The belly button. You take a couple of drops, put it in your belly button. If you have an innie, if you have an outie, you work around it. But you put the oil inside your belly button and then rub the oil inside your belly button and then 1 centimeter around the outside of the belly button, and it's absorbed that way, and it bypasses the liver. The different goal of taking the cannabis is to bypass the liver because, as he said, first pass metabolism, it slows down, and that's where the safety issue comes into play. All of them are metabolized through the liver, just at different ratios. Inhalation, not so much. Oral, very much so. And when you take a product orally, like cannabis, only 25 to 30% of what you ingest orally makes its way into the bloodstream, which means that you have to up the dose by 3 to 4 times as compared to the inhalation. So you have to be mindful of how much you're ingesting. So if you're going to take an oral dose, you're going to have to increase it by 3 to 4 times to get the same effect as you would with an inhalation.
Awesome. Great answer. Really good answer. Let's go ahead and open it up to questions. So do you guys have, I'll keep asking them questions if no one does. Yes, sir.
There was a brief mention of the acidic forms of the cannabinoids earlier. It seems interesting because the acidic forms have a different physiological response to their neutral counterparts. Have you guys come across any advanced research or anything that really speaks or extols the virtues of specific acid forms versus the neutral counterparts?
Well, for Rafael Meshulam, when I heard him speak last year in California, he was talking about how the acid form has 10,000 times greater affinity for the endocannabinoid receptors than the neutral form or the active form of the cannabis. So for that reason, he is promoting the synthesizing of the acid forms in the laboratories and then using that as medicine rather than the decarboxylated version of the cannabis. You guys?
You guys want to go? Or? Nope. Okay, good.
Can we run the mic for when they ask the question?
That's a good idea.
Yes. Thank you.
Or I can wander around.
I actually have 2 questions. One is, what is your suggestion if they are taking other prescription medications? Should they take their CBD, say sublingual oil, 2 hours apart from the prescribed medications, take it with the medications, or what do you suggest?
Yeah, that really depends on what medications they're on, right? Because if they're sedative type medications, you want to space that out because then you just get a double effect. If it's blood pressure medications as well, because they can lower blood pressure. If it's blood sugar medications, you want to space that out, 4 or 6 hours different between the two because all of those things can affect it. Now, if it's something else, it doesn't interact with how CBD works. You still most likely want to space those out because, again, if it's a low dose CBD product, you're going to increase the concentration of those medications. So if someone's already on like the max dose of something, I'm going to push them over to the toxic range by administering it with CBD. If they're at the middle of the line dosage, I may or may not do that. So I typically recommend that people don't take their medications at the same time they take their CBD, unless I'm intentionally trying to boost the effect of a medication, which we do that sometimes.
And then my other question was, do you suggest that someone takes it, say, a sublingual oil once a day or twice a day or 3 times a day?
I personally, and I get this a lot, and for example, it depends on what you're treating. Insomnia, the only time you worry about insomnia is at night, so why would you take it twice a day? It's not truly, I had not found it to be truly a sedative. It is a great anxiolytic or calming, okay? So people today we have a lot of anxiety in our world. We have a very uncertain world. Look at us all with masks here and how we got here, and we're all glad to be here because we finally got out of the house. So that tends to be an all-day thing. So I try to do twice-a-day dosing with those individuals. Now, some people are what we know as heavy metabolizers. They go through meds quickly, and like Doc said here, I mean, I advocate people who blood pressure medications because it does lower your blood pressure. It works very well for that. So I want them to monitor their blood pressures every day. And I actually ask them for their blood pressures to make sure that we're not becoming hypotensive, because it does lower it. And in fact, in some cases, we're able to slowly wean them off some blood pressure medications, which they're very happy about. And I work with their doctors on that. I don't do that arbitrarily, say, well, we'll just get rid of this and get rid of that. No. We have to work together. It's a collaborative effect. So, and also blood sugars, monitor the blood sugars as well. So those are things, because most people today, chronic conditions is diabetes and hypertension. So that's very easy for us to monitor, and a lot of people do that anyways. So I prefer twice-a-day dosing for those individuals for chronic conditions, for chronic inflammation, chronic pain, anxiety. But then obviously for insomnia, I just do once a day.
And to dovetail on that, what I like to do is I like to mix and match. Mm-hmm. So I have them do a sublingual oil and an inhalation at the same time. Why?
Interesting.
Because the inhalation takes, like I said before, it works within 3 to 10 minutes. Mm-hmm. Whereas the sublingual or the oral takes anywhere between 45 minutes to 2 hours. So they get the inhalation, they get the effect of the inhalation, but as the effect of the inhalation is wearing off, the effect of the sublingual oil or the oral is kicking in, and so now they're covered longer and better. And then they would use the inhalation as for breakthrough, just like when you treat chronic pain where you have a long-acting opiate and a short-acting opiate for breakthrough pain, same concept. So I use the inhalation for breakthrough, and then the orals or the topicals, topical cream, topical patches, for the long-acting effect. But mix and match, and that's why we go into the modes of administration and the speeds with which each one works, so that way and have an idea of better coverage for the patient.
Interesting. And my last question has to deal with children. Parents come in and my kids are on all this ADD medicine or this or that, and they go from one end of the spectrum to the other. What is your suggestion on what to tell people with children like that?
Well, I have a very large pediatric practice. In fact, not only in my office, but worldwide, because a lot of people from all over the world go to my website and get consultations for the pediatric cases. With pediatric cases, you have to be really mindful of what medications they are on because of the drug-drug interactions, number one, first and foremost. Number two, you have to be mindful of the dosing and their weight, because there I am a stickler. I dose pediatric cases by weight. And I'm very, I'm real anal because, by trade, I'm an internist. And so internal medicine, we're real anal retentive about how we do our stuff. Extremely. Do I get an amen?
Yeah, I'm an internist as well, so yes.
There's some real progress in it. I can just actual product out, and you can get it in our booth, True Medics, our CBD booth, but True Medics. But we have samples and stuff, but we have clinical data now on our progress with autism. So there's a lot, and that's something that we might discuss a little bit about where all this is going, because frankly, any disease of dysregulation can be addressed with cannabinoids. So.
But as far as like pediatric cases, and I see some other hands, so I'll be as brief as I can be. Dr. Aran in Israel has done 2 studies with autistic children, and the standard dose is 10 milligrams per kilogram. Okay, Epidiolex, which is the FDA-approved CBD product, it's the only product that actually comes from cannabis. Their recommendation is the starting dose is 10 milligrams per kilo, and you build up to 20 milligrams per kilo with Epidiolex. But that is an isolate. It's crap. It's $32,000 per year. Mm-hmm. And I have a family of 3. All 3 children have the Lennox-Gastaut gene. So that would be $100,000 for that family to provide medication for their 3 children. That doesn't include rent, food, medical bills, nothing. That's just medication. Per year.
Yes, I actually have a family member that was diagnosed.
But because they had Medicaid and the state paid for it, then they were able to get the product.
And that's kind of the nice thing about Epidiolex is it does get in the insurance system where most of this doesn't. So we've got time for one more question. And so far away. Make it a good one.
And any other questions, we'll be off to the side.
All right, thank you. Is there any evidence of someone who's been taking CBD for a while, they've found their dosage, it helps with whatever their issues are. Is there any evidence that eventually that person who has that chronic issue and takes it every day, like they're supposed to, that they're able to back off with the dosage? I mean, that it helps to, get their system in balance, helps with those deficiencies or whatever their issues are. I have a lot of customers who are on 100, 200 milligrams a day, and they have found that as their dosage for, pain, anxiety, and so forth. And they're hoping, and I'm hoping for them, that eventually they'll get much more in homeostasis and will be able to cut back.
I'm going to quote and borrow Ethan Rousseau's work on the clinical endocannabinoid deficiency theory, meaning that the reason there are diseases or lack of ease, if you take the word disease and split it up, it's lack of ease, dis-ease, is because our endocannabinoids system are not producing sufficient amount of endocannabinoids. And so for that regard, and that came from his thought process, okay, if there's a deficiency in dopamine, then the person presents with Parkinson type symptoms. If they have a decrease in acetylcholine, then they have Alzheimer's type symptoms. If they have a decrease in serotonin or norepinephrine, they have depression type symptoms. What happens if you have a decrease in anandamide, 2-AG, NADA, etc.? And so he began to study that. And the 3 most common conditions found with clinical endocannabinoid deficiency are migraine headaches, IBS, irritable bowel syndrome, and fibromyalgia. Okay? But then they added bipolar disorder, failure to thrive in children, etc. So the fact that they are on 100, 200 milligrams, that's what's needed for the endocannabinoid receptors to be saturated and compensate for the clinical endocannabinoid deficiency. As we get older, we produce less endocannabinoids. The more stress that we undergo, we also produce less endocannabinoid. Studies have been done with people post 9/11 that were workers, and they found that their endocannabinoids were decreased post any PTSD. So for that reason, you want to make sure that their dose is has been said by my pharmacist colleagues, the least amount of dose to get the proper benefit. But if something happens and they have a really crappy day, then they're going to have to kick it up a notch. If they're having a good day, then they don't need to kick it up that far. Yes. What do you guys say?
I agree. Yeah, I agree. And it depends on, again, supplements are supplements, right? So if they're in chronic pain and they're just taking CBD and they're eating McDonald's 3 times a day and they're stressed out and they're not doing any type of movement. They're sitting at a desk for 8 hours a day. All of that creates system disbalance. All right, and as we've talked about, the greatest benefit of the ECS is it is a wonderful homeostatic, meaning it's a wonderful balancing agent to kind of bring you back to center no matter which direction you sway in. But if you have 10 things pushing you off balance, one thing is not going to bring you back to balance. So I see this all the time because I focus on a total holistic picture. That's my practice. I have different tools for that, but I see it all the time. People are like, well, I'm doing this. I'm like, well, what else are you doing? And I find out they're doing 6 things that are counteracting that. I'm like, well, that's why this isn't getting better, and this is why we're not able to come down.
That's a great point, because I also
Yep.
think it's not going to cure all the issues that you have going, like body issues.
Yeah, believe it or not, how do you feed your endocannabinoid system natively? If you're a deer, right? So how are you feeding this system? Because deers have one, and your dog has one, your cat has one, your reptile has one, your bird has one, your fish has one. How do they feed it? It's fats. So it's really about diet. This all comes back to diet and having a balanced omega-3, omega-6 intake. So if you're balanced omega-3, omega-6, you're going to be healthy as heck in your endocannabinoid system. But you can't do that with our diet right now. You have to supplement because we have so many omega-6s in our diet. So, Jorge, you want last word, and then we got to shut her down.
Well, I learned something new today, just sitting up here, listening to these gentlemen here, so I'm sure y'all did as well. But I will say this, I tell this to all my patients, this is not a cure, okay? What we want to do is enhance your quality of life. And it's a multi-step process. Good sleep hygiene, good eating habits, exercise. If you feel better, you're more willing to do some more exercise, which means then you hopefully take the next step is to eat better, and then you get to sleep better. So it feeds itself, but it's a overall holistic approach. I'd rather take this than all the other medications that are out there, personally.
Awesome. Well, thank you guys very much. It's been a great
Any questions,
panel,
I'll be on the
so
side.
Thank you.